After the transplant, it was like a new person altogether.
Post-transplant is a great lifestyle change.
Because you feel so good now. It's amazing how the body reacts or how your mind reacts to pain and memory. You forget all that stuff.
It's an inner change to accept what you've gone through.
I wanted to live, and I was given this opportunity, and it's been the most wonderful experience.
Being a transplant patient presents many lifestyle adaptations after surgery. If you're like Mark, a kidney transplant recipient, you're ready for solutions that will facilitate your recovery and help you get back to enjoying life.
You know the temperature in Miami yesterday? 32 degrees.
Oh, perfect. I can't wait. I really need this holiday.
You and me both.
Hey, we've been doing everything right. We're going to do this right, too.
This video will help you identify the activities and events in your life that now require special attention and show you how to handle them. Things such as exercise and returning to work, getting an updated medical alert bracelet, rules you must follow concerning prescribed and non-prescription medication, proper sun protection, the importance of good nutrition, seeing your dentist and doctor, sexual activities, birth control, precautions concerning household pets, and even planning a vacation. There are some things you've never had to think twice about before, like driving and remembering to keep the seatbelt from irritating your incision.
A person can expect to return to the activity of driving a motor vehicle once they feel capable and have cleared this with their individual transplant coordinator or physician. There are some restrictions, however. If a person is experiencing headaches, dizzy spells, or visual disturbances, these signs should be reported to the coordinator, and of course they should not be driving a motor vehicle at that time. Also, if a patient is using pain control medication that contains narcotics such as Demerol, codeine, or Percocets, again, they should not be driving a motor vehicle.
No matter what type of transplant you've had, always wear a seatbelt. Just remember to protect your incision. Keep a towel or small pillow in the car and use it for extra padding until the area heals. For example, if you've had a lung or heart transplant, place the towel here. Liver transplant recipients need protection in this area, and kidney patients here. Exercise. It's good for you. Just take it easy for the first month or so. Don't lift anything over 10 pounds. Go easy on the abdominal exercises. Avoid push-ups and pull-ups, and don't push or pull heavy objects. Kidney transplant patients should avoid these activities for at least 2 months. Lung, liver, heart, and pancreas transplant patients, 3 months.
Patients following transplant, we do have individual programs for them. Specifically, the lung transplant patients, they come to exercise with us for the first 3 months, 3 times a week, and they do a gradual increase in exercise. The heart transplant patients, we give them an individual program as well, and we provide education for them in that they have a denervated heart and they don't have a normal response for exercise. So we make sure that they follow their signs and symptoms and comfort levels for exercise. And for the liver patients, again, we get them up, mobilizing them, making sure they're independent and walking and stairs, and give them a gradual exercise program in preparation for home.
When I went into the hospital, I obviously wasn't feeling well, and I was in a bed for 3 weeks. And I got up and I looked at my legs, and my legs were really thin, and they had never been that thin before. So I knew that I had a lot of work to do.
2 to 3 months may seem like a long time not to be able to do something as simple as lifting a 10-pound weight, but it's 6 weeks for other types of surgery. The reason it's more for transplant recipients is your medication delays the healing process.
And you give that a try, see how that feels.
All right.
So think about what you're doing at all times. A bag of groceries or a small child may be more than you can handle. This may require some problem solving for mothers home all day with youngsters. Every day, things that you once took for granted, like grocery shopping, lifting appliances, or moving furniture, now require special consideration. And remember, it's not forever.
I started exercising. I was swimming. I took up swimming because that was one of my choices. I did do stationary bike also, and I wasn't working, so I did a lot of mall walking, which really helps for those who don't have those facilities available to them. Walking is probably one of the best ways to get back in shape.
Hey, Mom! Dad's gonna want to take these to Florida.
He's going to want to, but I think this is the only club that's going to see any action.
As soon as you feel ready to do more strenuous exercise and the proper time has elapsed, discuss it with your transplant clinic physician. Talking things over with your physiotherapist is always a good idea, too. You may not be able to do things exactly the way you did before your surgery. Your physiotherapist can offer alternatives that will allow you to continue to do the things you enjoy.
They suggested that I go back to my bicycle, and I'm back to 10 kilometers, and I try to do it 3 times a week.
Once you receive permission from your transplant team, you can return to work.
We see returning to work in the post-operative period as a normal aspect and part of the post-transplant phase. Our patients do many different occupations, and whether it's a job at home where you're lifting laundry or vacuuming, or doing a job in a factory where it's welding, there is absolutely no restriction.
If they have a job which requires a lot of physical activity, this may make the return to work a little bit longer than somebody that has a desk job.
I made a decision to return on a part-time basis, just to ease myself into the workforce, and my work didn't have any problems with that, so we made an arrangement, and then gradually over time increased my hours until I eventually returned full-time.
I was back fairly early because it wasn't that strenuous. I go to a desk and I work the phone, and I get in my car and I drive and I meet people, so it wasn't that tough to do. Probably about a month and a half to 2 months after the transplant, I was back.
Any patients with individual concerns about the returning to work should discuss it with their transplant coordinator or their transplant physician, and appropriate considerations will be taken in at that time.
I need a few things for this trip.
Wow. For the first time, my list is longer than yours.
I'll just be a minute. I'm heading for the cosmetic count.
Yeah, okay. I'll see you over by the sunglasses.
If you have a MedicAlert bracelet, it needs to be updated and replaced. The form is available from your transplant center. Fill it out before you leave the hospital. Your transplant coordinator will be happy to assist you. And once you receive your new bracelet, put it on and don't ever take it off.
In the event that a transplant individual is unable to speak, it is important that they have their MedicAlert bracelet or necklace on so that they can be identified as the transplant individual who's immunosuppressed.
There is a simple rule to follow when it comes to taking any medication. All medication, whether over-the-counter or prescribed by your family physician or general practitioner, must be cleared by your transplant coordinator or transplant physician. This includes all cold, flu, and allergy relief products. And never take pain relief tablets containing aspirin or ASA unless specifically prescribed by your transplant physician.
The problem with taking a medication that hasn't been prescribed by your transplant physician or surgeon is that it might interfere with your transplant medications.
Tylenol plain is usually recommended for incision pain or a headache. If your headache or pain persists, notify your transplant team. These days, everyone should wear a sunscreen, and transplant recipients are at an even greater risk of developing skin cancer because of the immunosuppressant medications they take. Remember to examine your skin regularly and look for any abnormalities. Make a note of any change and report it to your transplant coordinator.
It's important for patients to wear sunscreen every day, especially whether it's cloudy or whether it's sunny. On cloudy days, though, we're often forgetting to wear them. And the reason being is people don't think the sun is getting through. But the sun can get through 70 to 80%. And it can also be, if you're near water, sand, concrete, or even snow, the sun will bounce off and can affect you.
It is very important to apply sunscreen a half an hour before going out into the sun. Also, in order to apply it, it should be applied liberally on all exposed areas except around the eyes.
Choose products with the highest sun protection factor, or SPF. Experts recommend 20 to 30, and an opaque sunblock for the most exposed areas like your nose, ears, and shoulders. Use a hand and facial cream also with a high SPF. Your clothing needs to be lightweight and long-sleeved. And wear a hat. It's best to avoid going outside when the sun is at its strongest. This is usually between 11 a.m. and 3 p.m. And don't forget, your eyes also need protection from ultraviolet or UV light. Make sure you buy sunglasses that filter out UV rays.
Hey, take a look at these. What do you think?
Not bad. I don't think your son will be seen with you, though.
Why not?
Yeah.
Before you received your new organ, you were most likely following a special diet. Now that you're on the road to recovery, you are progressing back to a regular diet. Good nutrition is extremely important to maintaining your good health.
We want people to eat a well-balanced diet. They're normal now. A normal, healthy lifestyle is eating a well-balanced diet. And our transplant dietitian is always available for people who are having problems or need some guidance in this area.
Be sure to use the tips your dietitian gives you on how to control salt, calories, fat, and cholesterol. The medication you're still taking could cause your blood fat and cholesterol levels to rise. Drink 6 to 8 glasses of water every day, but avoid drinking mineral water because it may contain high levels of salt. Spring water, on the other hand, is just fine.
Because of the medication, my appetite increased, and I thought how marvelous, and I was eating everything, and I was really enjoying my food, and then suddenly I noticed, well, I could feel it too. I'd put on 15 pounds.
After transplant, what I looked forward to was having a bit of salt in my diet, and it made things taste so much better.
It's important to strictly limit your alcohol consumption because while alcohol doesn't interfere with your immunosuppressive medication, it could interfere with other medications you're taking. As well, there are problems that could result by overindulging, like errors in judgment or missed medications.
We monitor blood levels really closely. Alcohol intake can alter those levels, so we may misread the data, and we don't want to do that and put the patient at risk as well. We ask that patients treat alcohol as something they have only on special occasions. So if there's weddings or birthdays or special family celebrations, that they can have a drink.
And my body now tells me that I have to drink in moderation. Whereas before, when I was sick, I didn't feel caffeine, I didn't feel alcohol. It was all just part of the poison that was in my blood. And now it's all cleared out so quickly that it goes to my head immediately. I mean, I'm a cheap date.
You know, improve your putting and you improve your entire game.
You're right.
Putting separates the pros from the amateurs.
Oh, I agree.
Hey, maybe you can become the putting king of North America. Go on Letterman even.
Okay, you've convinced me.
Sexual activity is one of the topics that we like to talk to our patients about. Many people are reluctant to bring up the topic because it's very personal and many people get embarrassed about it, but we believe that sexual activity or our sexual beings is really a very important part of us and who we are, and it's important to think about it just as much as it is about blood pressure or any of the other health things that we think about. We find that many people prior to their transplant have not been sexually active because they've simply been too sick. But after their transplant, as they get better physically, most of them will resume sexual activity and will become a sexual being again.
I felt good about myself. I had a lot of vibrant feeling, wasn't tired, so I had to do, I guess, extra activities and enjoyed sex a lot better after transplant.
The problem isn't so much interest at this point in time, it's performance, especially for males. Males have a problem with, a lot of males do, with performance. They are impotent or partially impotent, and the reason for this is that the drugs that are used to protect the transplanted organ have side effects. They affect sex hormones, and in men this causes a lack of normal sexual performance. This is a common problem. It is got to be addressed openly and frankly. There are solutions to the problem, but it is of concern to a lot of patients, particularly men.
If you're involved with sexual activity with a partner that you've not been involved with before, that it's very important that you protect yourself by either wearing a condom or having your partner wear a condom, because you are much, much more susceptible to infectious diseases, not just HIV, but herpes and many other diseases that you can catch sexually.
I think I was pretty much back to normal pretty quickly. I think almost the adoption period or adaptive period was not for me. It was more for my wife, I think, because she was more curious than than I was, even hesitant. There's a lot of pressure for the spouse involved as well in all this, and I think that she had more of a difficult time coming back to it than I did.
Many patients ask us about the possibility of becoming pregnant or in fact of fathering a child after a transplant. And this is an area that is very individualized and which we encourage you to talk with us about. Many of the medications that you need for the transplant are reported to potentially cause birth defects. In the doses that we use, we don't find a great deal of difficulty in that area, but pregnancy for a woman who is a transplant patient is a very big undertaking, and we really stress that every pregnancy be a planned pregnancy.
It's very important that a patient not become pregnant in the first year following transplantation, during the time in which rejection is the highest. And thereafter, there's probably some risk, but on balance, most transplant physicians and surgeons believe that risk is low.
But not wishing to have children now, we've decided to go with condoms and foam rather than taking a chance of pregnancy.
If you're considering pregnancy, it's very important to discuss this with your transplant physician or surgeon before you get pregnant.
Along with taking care of your new organ, it's important to take care of your whole body. Have a yearly checkup with your doctor and ophthalmologist. The medications you are taking do put you in a higher risk category for certain types of cancer.
We think it's particularly important that our female patients see their gynecologist on an annual basis for a pap smear and for a breast examination. Similarly, our male patients are advised to see their physicians on a yearly basis for a testicular examination and a prostate exam because, again, of an increased risk of malignancy in those areas.
Your rejection medication also makes you an easier target for some of the common flu bugs. So you'll also need a flu shot in the fall, unless you have an allergy to eggs.
The reason that someone who's allergic to eggs, that they would not get the flu shot is the fact that the vaccine is made up of the protein which is similar to the protein found in an egg.
Dental hygiene is also very important to maintaining your health. Along with brushing and flossing twice a day and biannual checkups, there are a couple of important things to remember. You absolutely must inform your dentist that you've had a transplant and what medications you are taking, including cyclosporin. You may need to take additional antibiotics to prevent the chance of infection before you have any dental work done. Any. And that includes a routine cleaning.
We should be notified at least 2 weeks prior to your dental checkup in order that we may give you some antibiotic coverage if it is necessary. It's very important if infection is there that it be treated immediately, because when you're on immunosuppressive therapy, the infection can go through the body very quickly, and we want to prevent this.
If you have a pet or are considering bringing a new companion into your home, talk it over with your transplant coordinator or physician.
Everybody loves their pet, and we would just ask if you have a pet that you take certain precautions. We're concerned about the dander that pets can have. For example, if you have a dog or a cat and you've had the habit of like fluffing up their face and talking to them really closely, then we would have concern about that dander causing a particular type of pneumonia. It's infection that we're worried about. The droppings from a bird we'd be concerned about, and birds is something that we would need to discuss if that's a very important pet that you have. Litter is a problem for cats. We're worried about the dust in the litter box and the feces in the litter box, and we prefer that someone else look after it. But if you have to, gloves and masks are a good idea to prevent inhaling that and touching that.
We're going to be away for 2 full weeks. Yeah, he's a little nervous, yeah. No, relax. We've got everything totally organized and we're completely prepared. Yeah, we're even prepared to stay on a few extra days if we're having fun. And that idea is sounding better and better to me all the time.
We want transplant patients to return to normal, so we want them to have as normal a life sort of pattern as possible, and traveling is certainly an important aspect of living a full life. We do caution patients, however, not to travel in the first 3 months after a transplant. The reason for this is that it's during this 3-month period that most of the problems can occur, especially with rejection. The incidence of rejection is highest during the first 3 months. Patients have to be monitored carefully, and they really should be quite close to their transplant center.
Of course, you want your holidays to be as worry-free as possible. A few do's and don'ts will help ensure everything goes right. Always discuss your travel plans with your transplant team in advance. Get a few extra days' supply of medication in case you're delayed returning home. And buy airline cancellation and out-of-country medical insurance.
We would ask that our transplant patients carry with them a letter of information. That letter contains information regarding their drugs, their latest blood work, and emergency contact numbers with the physicians and coordinators' names from this hospital in case they would require any medical attention while out of the country.
Some countries require you to have certain vaccinations well before you leave. This can be arranged through a travel clinic. And remember to carry your medication and your medical papers with you on the plane. The stable temperature in the cabin is better for your medications, and you will not risk losing them if your luggage is lost. Traveling is a big step for all transplant patients. Knowing you have done everything to make it a successful event includes being prepared to return home should you become ill while you're away.
If anything were to go really, really wrong, I would come home. I was on this travel agent's fam trip in Turkey, and I kept up with everyone. And in fact, I was very pleased with myself because no one knew I'd had a transplant. I didn't want them to feel sorry for me. I didn't want them to say, oh, we'll have to wait for Phyllis. And we went through the ruins at Ephesus, and I did all the walking that everyone else did.
Phew, we did it.
Boy, it's a miracle.
It sure is.
Beach, pool, t-shirts, sand.
Oh. Dad, you look kind of funny in those sunglasses.
I do?
Mm-hmm.
Knowing what you can't do, what you can do, and when you can begin doing it is the key to a successful recovery.
No, the hotel was great. Yeah, our balcony looked right over the pool.
And always remember, your transplant team is there to help you every step of the way.
Since the transplant, life has been more than 100% better. I'm active. 3 years ago, I had my daughter, Sarah Lynn.
I can take walks, I can do things for myself, I can prepare meals for myself and don't have to rely on anybody.
I feel wonderfully well. I must say I feel better than I felt years prior to the transplant.
It just felt great. I mean, it was a small miracle from the way I'd felt from progressively getting worse to absolutely feeling wonderful.
It's a life-giving thing.